Bismillahirrahmanirrahim. Now, I would like to talk about Avicenna's contribution to pain. And I'm Dr. Ahmed Fawad Pirzad, Faculty of Kabul Medical University of Sciences. Outline of my talk is Introduction, Avicenna's description of pain within the canon, nature of pain, ya waja, types and cause of pain, effects and diagnostic value of pain, pain relief, conclusion and references. The management of pain, like the management of diseases, is as old as mankind. This one act allegedly set as stage of several diseases concepts, including the experience of pain in labor and delivery. The concept of that hard work is painful. The notion that blood, sweat, and tears are needed to produce fruit. The introduction of pain and disease to human existence, the establishment of the fact that hell and its fires are painful, and the expectation that heaven is pure, delightful, spiritually pleasing, and of course pain free. In these concepts, pain is viewed as a negative experience and one that is associated with disease, morbidity, and the dying process. Most diseases, including infections, plagues, metabolic disorder, example diabetes mellitus, endocrine disorders, hypertension, and cancer, of course, affect mankind spontaneously and usually cause significant pain. Pain related writings with the canon were identified and analyzed and compared to Galen and modern pain theory. Researchers found evidence in the canon that Avicenna challenged the Galen's concept of pain. Galen insisted that injuries, breach of continuity were the only cause of pain. In contrast, Avicenna suggests that the true cause of pain was a change of the physical condition, temperament change of the organ, whether there was an injury present or not. Avicenna extended Galen's description of 4 to 14 types of pain and used a terminology that is remarkably similar in the McGill Pain Questionnaire. The canon of medicine was Avicenna's account of the sum of medical knowledge from the period in which he attempted to amalgamate the works of famous Greek physician Galen of Pergamon with known Eastern medical practice, especially the work of Al-Razi in Kitab al-Hawi. Avicenna also added his own contribution in what became the reference of medicine for almost 6 centuries. This is the image of Kitab al-Qanun fi Tib. and it was handwritten. The general rule was a good doctor must be a good Avicenist. When the canon fell out of favor, it was burned in Basel by Paracelsus as an objection to Avicenna's doctrine. Avicenna held in Eastern for many pioneering descriptions, including surgical procedures and disease, such as diabetes, although nowadays much of his work is studied for historical interest. Interestingly, few modern day scholars have explored Avicenna's understanding of sensation and pain. In 1993 textbook The History of Pain, Ray highlighted an absence of research into pain from Avicenna era. However, only one page within this 409-page book was devoted to Avicenna work. The aim here is to present analysis Avicenna's writing on pain using an original Arabic manuscript of the Qanun, which was printed in Rome in the 16th century. Many of approaches of physician in medieval East are accepted today. However, still more of them could be of use to modern medicine. Nature of pain, waja, dard. In the first volume, Avicenna defines the nature of pain and describes it in 5 pages. He classified pain into 15 types and relate each type to cause. He uses the word waja, means hurt, as a general name for pain. However, he also uses alam, also means pain, interchangeably with waja to describe how the patient feels. Nowadays, both words are in common use. Alam means pain, dard. To avoid confusion, modern Arabic texts use alam as the scientific term for pain. Avicenna defines waja as a one of unnatural or abnormal condition that affect the body and that it's a feeling of incongruity. He offers further clarity in the statement waja is the sudden sensation of a different stimulus. He provides an example how a man would feel if he was exposed to change in water's heat during a bath. However, if the man's body gradually adapted, he would not feel any pain. Avicenna introduced pleasure as the opposite feeling of waja. Sense of touch. Avicenna associated the sense of touch with the strongest feeling of pleasure or pain, but clearly acknowledged that other senses are able to produce both sensation. Avicenna subscribed to Galen's description of temperament, physical condition of organs, hot or cold, and dry or wet. For humor, it was suggested that the word description of different layers of blood if it was left in a container for an hour or more. The concept is simple. All health and illness conditions are result of balance or imbalance of these four bodily liquids. Using Galen's terminology, Avicenna grouped waja into two broad categories. The first category described waja according to sudden change in temperament. The second category described interruption in continuity, which is a concept described by Galen as an alteration that break, cut, stretch, or abrade. Avicenna criticized Galen for being dogmatic about the interruption of continuity. Avicenna also indicates that pain may persist even the original stimulus had disappeared. He classified this pain as a not true pain and suggested that doctors should not attempt to treat it because the cause does not exist. This consistent with modern pain theory, which recognizes that pain can often occur in the absence of injury. Avicenna agreed with Galen that nerve carried pain sensation to the brain. Avicenna wrote extensively about brain anatomy and its role as a reason for pain sensation. Avicenna wrote extensively about brain anatomy and its role as a center for pain sensation. Both Galen and Avicenna believed that the brain was the principal organ for perception of pain. It is now well established that there are specialized receptors in many different tissues of the body, and their activation may lead to the sensation of pain, which occurs in the brain. Recent advances in pain research, while this is enough to explain nociceptive pain and neuropathic pain, the International Association for the Society of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage.